Abnormal heart sounds 1. S3, third heart sound. Ventricular gallop. Occurs just after S2, early diastole. Indicates rapid ventricular filling or volume overload. Common in heart failure, mitral regurgitation, or children, young adults. Physiologic S3. 2. S4, fourth heart sound. Atrial gallop. Occurs just before S1, late diastole. Caused by forceful atrial contraction against a stiff ventricle. And seen in hypertension, aortic stenosis, left ventricular hypertrophy. 3. Murmurs. Caused by turbulent blood flow through the heart or valves. Classified as systolic murmurs, e.g. aortic stenosis, mitral regurgitation. Diastolic murmurs, e.g. aortic regurgitation, mitral stenosis. Graded IVI by loudness. 4. Clicks. High-pitched sounds, often due to mitral valve prolapse or prosthetic valves. 5. Snaps. Sharp sounds in mitral stenosis caused by stiff valve leaflets opening. 6. Pericardial friction rub. Scratchy or grating sound heard during systole and diastole. Indicates pericarditis, inflammation of the pericardial sac.